Hi, my name is Dr. Jacobs. I'm a doctor of physical therapy, advanced clinical nutritionist, and inventor of ASTR. After my second cancer treatment, I used to suffer from chronic pain, migraine, headache, fatigue before I invented ASTR's specialty. All right, Werner, tell me what's going on with your feet. What happened with your foot?
I got pain in my feet right when it was worse than the left.
Okay.
So
how long this been going on, and how did you hurt yourself too?
I was reinstalling a mailbox on our front lawn, and the next day I had pain. It's been going on for probably about 4 to 5 weeks.
4 to 5 weeks, so about months. Okay. So how much pain, and what's difficult for you to do?
Walking is very painful. Getting out of bed in the morning is extremely painful. I just push through it because I have to.
Okay. So you feel in the morning you're stepping on ice or like glass or sharp surfaces?
It's throbbing, yes.
Throbbing, okay.
Yes.
Where do you feel it exactly?
In the heel area, and sometimes on the ball of the foot.
Okay.
Oh.
So, what kind of treatment you had in the last months for that?
PRP, acupuncture, chiropractic adjustment.
Okay, massage, did you have that? Or
yes, massage
PT?
therapy, no PT.
Okay, all right. So, currently, how much pain from 0 to 10?
It can get up to a 10. Right now, sitting like this, it's okay. It's maybe like a 4, 3, 4.
Okay.
But as soon as I start walking on it,
so weight bearing
escalates.
aggravated.
Yes.
And morning aggravate your pain.
Yes.
So
Morning
that's
I'm limping.
Limping. So it's a classic plantar fasciitis, but
Yes.
also on the higher side of it. So we want to aggravate your symptoms just for now to assess how you feel.
Okay.
So we'll have you walk in the hallway back and forth and let me know from 0 to 10 how much pain there.
Okay.
And then we'll do the treatment and we'll come back and reassess. Okay.
It's painful.
How much from 0 to 10?
I'd say about an 8 right now.
8, and where do you feel it exactly?
It's right in here.
You're really limping. So if like you generally don't limp like
No,
this.
I walk very fast.
Very fast. So that's for you. It's really slow and
Yes.
like limping. Okay. So we'll have you lie on your stomach, head this way.
Okay.
Okay. Make sure what I'm doing is not painful. How does feel?
That hurts.
Okay. Sorry. Make sure what I'm doing is not painful. Okay.
Okay.
Because I wanna release the proliferation stage without causing inflammation, so make sure it's not painful. It's okay to feel pressure. It's not okay to feel pain. How's that feel?
I feel it.
Okay, so I know you feel pain. The goal is not to aggravate that symptoms.
Right. But
You know?
it's tolerable. It's very tolerable.
As long as I'm not increasing your pain level right now, that's
Okay.
fine, okay? What about now?
I feel it, yes.
Pain or pressure?
Just a little bit of pain when you press there.
Sorry. What about here?
That's just pressure.
Okay, but any pain here?
No.
You see how much pressure I apply? It's very light pressure.
Yes.
actually. So when you feel pain with the light pressure like this, that's an indication of inflammation in that spot.
Yes, I feel pain when you're on the bottom of the foot, but up on the calf there, no pain at all.
Okay. So maybe I will need to desensitize that with the Magna Heal. So do you have seizures or pacemaker or anything like that?
No.
Okay. How's that here?
I feel a little bit of pain.
Sorry. Okay. What about here?
Nope, no pain.
No pain. Okay. What about here?
No pain really.
Okay.
Just a hint, but nothing really.
I'll show you the scar tissue. You have a little scar here, like a little cut. What happened? In this spot.
Probably, I remember as a kid I cut my foot.
That's very unusual area to cut. Did you step on something?
Yes.
Okay, so that's probably. Yeah, I can see the line here. Did you have any sutures or anything there, or?
No.
Okay. What about here?
Very, very minor.
Okay. So your pain increased with weight bearing and dorsiflexion or plantar flexion?
Correct.
Both?
Yes.
Okay. You have a little bit of edema in there, swelling in your feet.
That started with,
You feel that scar tissue here, this bump?
yes.
It should feel like nice and smooth like this when you don't have a scar tissue.
Okay.
So it's a lot of scar tissue here.
I've had that for a long time.
Hmm.
Years.
So you're aware of the scar tissue, yeah?
Yeah, the bump, I've known about that. I've had that probably, 20 years.
Wow. How did you do that, or just
I don't
bad
know.
mechanics or something like that? Okay. Make sure what I'm doing is not painful here, and you have it here too. Feel that? Did you feel that scar tissue when they work on you, like the massage therapist?
No, not really.
Okay. Oh, sorry.
That's okay.
Don't kick me, okay?
I won't.
All right. We have evidence here. Is that too much?
No, that's fine.
You feel that knot here?
Yes.
Okay, that's a scar tissue. Make sure you let me know if it's too much, okay?
Okay.
I will try to dig in, but not too much to cause inflammation, but I wanna to break the scar tissue here. How's that?
That's okay.
Okay. So you said the lateral part too, yeah?
Sometimes, yes, I'll have pain on the outer edge. And I did that day when I was fixing the mailbox because I was bending and leaning and
You were wearing shoes or no?
I was, but they were my, your big flappy shoes that you've had for years that don't really give good support, but you wear them around the house.
Okay, we're gonna go over the right shoes, sorry, after we finish with this. To make sure. I'm gonna work on your arch to correct it. We might be able to correct it with exercises, so I gotta give you exercise to do that.
Okay.
Because it's definitely, your arch is collapsing a little bit. How does that feel?
It's tolerable.
Okay, but you feel those like kind of grain or rocks in there, yeah?
Yes.
Those are scar tissue here. It's not too bad here, it's right in here, this one. And you said your heel is fine, or you have issue with the
Sometimes the pain will shoot into my heel.
Mhm. Too much?
Nope. I know we need to break up the scar tissue, so I
But
can...
we don't want to cause inflammation.
Right.
Think about this way, if you have open wound, do you want to rub it?
No, of course not.
So if internally you have inflammation, you need to give me a feedback because it's similar to open wound. We don't want to really
Okay.
inflame it more. That's why I don't like the idea of causing pain. I have the Magna Heel. We can jump to the Magna Heel if that's not tolerable.
Okay.
That's for inflammation, so we definitely can do that.
Yeah, that's painful.
Sorry, okay. Okay, so let me actually try to move your leg now and tell me, do you feel any difference? Dorsiflexion, plantar flexion?
This doesn't bother me.
Okay.
This is a lot better.
Okay, is it gone or you still feel it?
Just a little bit here.
0 to 10?
Probably like a 2.
Oh, so 1 down to 2, that's good. Okay, so I'm gonna use the Magna Heel now.
Okay.
If you have mild inflammation, few minutes with the magna heel should be enough.
Okay.
Okay? So that's another indication how bad is your inflammation.
Okay.
Because you're still sensitive, so I just want to get that localized inflammation under control, okay?
Okay.
And after that, I will actually use the tool to see how much I can dig in after desensitize it with the magna heel.
Okay.
How's that feel?
Fine.
Okay. Okay, can we get some water, please? Okay. So, let's actually move it dorsiflexion, plantar flexion, and tell me how that feels. Feel it or it's gone?
Yeah, it's gone. I don't feel anything anymore.
Let's set up for me. We're gonna give you some water before you stand on it. And,
Oh, thank you, sir.
so, I waited for the magna heel until the end to see how, if
Yeah, that's really good.
purely from proliferation stage or inflammation, a little bit inflammation. So, let's drink a little bit more water.
Oh, okay.
Okay. When I release the scar tissue and the fascial restriction, that's release toxic sin waste product, so
Oh,
I want to
yes.
make sure you flush it out so we not get confusing soreness
I
from
understand.
the toxics, you know. So we'll have you walk again from 0 and let me know from 0 to 10 how much pain,
Okay.
if you feel pain.
Yeah, really good.
Any pain or it's gone?
Just a little bit.
Where?
Maybe like same place on the arch, but it's a lot improved. But well, now it's getting worse again. See,
Where?
it's in here, right in here.
Oh, that spot.
Yeah.
Okay. So when you walk more, you feel more pain. Is that correct?
Yes,
Okay.
it's better,
Okay.
but yeah,
I'm gonna work on it. We're gonna do more for inflammation.
and it's now it's coming. It starts here and it goes into like right here.
Well, I did not work on that spot.
Okay.
Okay, we'll work on it. But I want you when you walk to land on your heel.
Okay.
Let's try it now and see if picking up your foot that made it change a little bit. Yes or no?
Yes.
You're landing in the wrong spot. We're gonna do some gait training to really walk on the right spot, so you're not really.
That actually relieves the pain's not as bad when I
When
walk
you do
like
that.
that. Yeah.
So think about this way: if you have bad ergonomic or gait, it's similar to you building a house on a crooked foundation.
Okay.
Everything else will be
Wrong.
affected. So especially with the feet, if you don't land on your heel,
Okay.
you're stepping on the
On the arch.
tilted foundation. We should not step on the arch.
Okay.
That's not your weight bearing. Your weight bearing on the heel to walk.
Okay.
Okay. So let's try it again and tell me how does that feel. You still feel pain or it's gone?
I still feel it in the arch area.
How much from 0 to 10?
Still about 2.
Okay. So I will work on it again, but I want you when you walk the right way. So
On the
you
heel.
so like because if you go back and walk the wrong way, it's
There's nothing. Yes.
nothing.
I'm just re-injuring it.
You know. How's that?
I feel that. Wow.
Sore. Yeah. Wow. Okay. What about here? Too much?
No, that's okay.
Okay. What about here? You feel that scar tissue here?
Yes.
Okay. I think part of the issue is you're landing on this wrong spot.
Okay.
You should be landing on the heel. So we're gonna practice that more. How's that?
That's good.
Okay.
That's when I use the golf ball there. That's where it really
Ooh.
hurts.
I will hold on that, okay? You could cause
Okay.
more scar tissue with the golf ball, okay?
Okay.
So I usually don't give that to patient because that could cause more inflammation. You feel that grinding here?
Yes.
Okay. Gonna use a magnet again on this spot. Okay. Here you go. Oops. Lift your legs up a little bit. Relax. Okay. So it's right in here, is that correct?
Yes.
Okay. Going down to here or just in here in that spot?
Just on that spot, more towards the outer edge.
In here?
No, the other way.
In here, so the inside.
Yes.
Okay. The right way of treating is, instead of thinking, oh, muscle tightness, do stretching or strength for muscle weaknesses, we need to start to think about the normal healing cycle and where the patient is stuck.
Okay.
And if the physician or the healthcare providers have the right tool to interfere with those areas in the healing cycle to transition from inflammation to proliferation to maturation, that's a treatment.
Okay.
But if they do not ignore or overlook the healing cycle and start to like, okay, let's do stretching, let's do massage, or let's do something to relieve the pain, but
No real treatment.
that's not a root cause of the problem. So you need this treatment more frequently because the problem has not been addressed yet. How's that? You're walking faster now.
Yeah.
Are you trying to show off now?
I would say my pain is like 0 now.
Okay, we'll walk a couple of times, okay?
Okay.
That's beautiful. You just walk the right way. We're definitely going to work a little bit more on the gait. So you're weighting your heel all the time. You heel to walking.
Yeah, this is fine.
All right. So you had PT, not PT, chiropractor, acupuncture, PRP you said in here?
Yes.
And
That was
massage
painful.
and acupuncture. So
Yes.
can you tell me any difference between the treatment you had before and ASTR treatment?
Yeah, now I have no pain with yours, but with theirs I still had pain.
Yeah.
And it was the PRP was really painful. Putting
Yeah.
needles injecting into your feet is not.
Yeah.
Yeah.
Nobody like injections.
No.
Yeah.
But
Yeah.
no, this is good.
Yeah, no, I'm glad you're feeling better. Yeah. Thank you.
Okay.
Let's
Thank
walk
you.
one more time. Yeah, let's
Yes.
walk again. Keep going. Yeah. How's that?
Very good.
Very good.
Very
Awesome. Yeah. So, want to walk one more time?
Yes.
Go ahead.
You're trying to make me exercise. I see.
Well,
Yes.
the proof in the pudding, you know.
Yes. Yes.
You know.
I agree.
Before it's the first few steps and you start to feel it. So
And it's always the heels. I've already adjusted to that.
yeah, we'll just
No, I
get
was-
used to it.
Yeah. I didn't realize I was walking wrong.
How was that?
That
Any
feels
pain?
good. No, pain is gone almost. Like totally.
Beautiful. We did it like what, 6 times now?
Yeah.
Going back and forth. Okay. Awesome.
Awesome.
Thank you.
Thank you very much.
Thank you. Feel free to subscribe to my channel to get helpful tips on relieving pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to receive treatment or treat yourself at home, check the link below. If you are a healthcare provider and would like to be ASTR certified and would like to buy ASTR tools, check the link below. See you soon.